Hello, I'm Dr. Mark Besancon, and this is your pet tip of the month. Today we're going to be talking about arthritis. Arthritis is really common in dogs, especially larger dogs. Another name for it is DJD, or degenerative joint disease. What it is it's actually the breakdown of the cartilage that's in the joints that gives the joints a cushion. That cartilage breaks down and causes some severe pain and can turn into some other things that cause a lot of pain in that joint. That makes your pet uncomfortable, more common in dogs, like I said. Some of the clinical signs that you're going to see at home, intermittent lameness. These guys are going to be lame in one leg or both legs, depending on what joint is involved. If it's an elbow joint, it'll be up in the front leg. If it's in the hips, commonly seen in labs, it'll be in the back legs, and they may be lame. Their gait may be real stiff. They may walk with a stiff gait, not want to move around very much. A lot of times these guys will warm out of their lameness or their stiff gait. So as they start to move around, it seems like they get to moving a little bit better. And so watch these guys. If they look like they start to warm out, sure could be arthritis as well. It seems to be worse whenever these guys lay down quite a bit. If they lay down and they're recumbent for a long time, and then they get up to move around, they may be more stiff. That's pretty common with arthritis, and you may see that as well. Weather change, whenever cold fronts blow in, their joints hurt a little worse, and then you may see them a little more painful whenever the weather changes some as well. More commonly seen as they age, and so older dogs, typically, it's not really a sign, but older dogs typically, just due to their age, will tend to have more arthritis than would a young dog. Some of the physical exam findings that we would see in the clinic or at home, like I said, the stiff gait. They'll come in with a stiff gait. They may have a lameness in a certain leg that's affected. Decreased range of motion. When we extend these guys' hips or legs or different joints, they may not want to extend it as far just because it hurts. There's a lot of inflammation in the joints, and they don't want to move them very much, and you'll see that on physical exam. You may have some pain at the joint that's affected, maybe some swelling as well. And so if you see some swollen joints, that also could be a sign of arthritis as well. How do you diagnose arthritis? The biggest way that veterinarians diagnose it is with radiographs, x-rays. We take x-rays of the joints, look for certain things in there that your veterinarian can work with you and show you as well that are signs of arthritis. Other testing may need to be done to rule out some different things to make sure that it's just arthritis and not anything more severe. But your veterinarian would be able to work with you on that to come up with the right testing for your pet. How do you treat arthritis? There's two big treatments for arthritis. Several treatments are out there that are available. Your veterinarian can work with you on that. The two big treatments are NSAIDs, non-steroidal anti-inflammatories. There are several out there for dogs and cats for that matter that will help with the pain and the inflammation in those joints. Another thing that helps quite a bit with these guys is chondroprotectants or joint protectants. Your glucosamine chondroitin sulfate. Those are big supplements that help these guys. Puts a little fluid back in the joint, helps the articular cartilage, or that cartilage that gives the cushion in those joints, helps that to make it a little bit healthier so that the pain is not as bad. There are some other treatments, surgical treatments, different things like that, depending on the severity of the arthritis, and your veterinarian can go over that with you on a case-to-case basis. Some of the risk factors that can cause arthritis to be worse: obesity, patients that are overweight. There's just more weight, more strain on the joints. Definitely, if you have an overweight dog, you definitely want to try to get some weight off of these guys to take some of the pressure off of these joints. Working dog, athletic dogs, just because they are moving around more, they're having a little more trauma in those joints, they're more likely to develop arthritis. Not that they ever will, but it could be a risk factor for these guys as well. Luxating patellas in little dogs, some just joint problems in general that are not associated with arthritis but can cause arthritis. Joint problems, trauma, young dogs or any dogs that have trauma to the joints can sure cause later in life arthritis. And so if there's a history of some type of trauma to a leg, a joint, anything like that, may not show signs of it right away, but arthritis may form in those joints and cause a lot of problems. So things you want to look for is just any kind of lameness, any stiffness, definitely obese dogs. You want to make sure these guys cut a little bit of weight off of them to try to keep these joints from so much pressure on these joints. And look for any stiffness, weather changes, anything like that, and get these guys into the veterinarian to get an exam and get them on the right treatment. Have a good day. Thanks.